This virus will be with us for a long time to come. Until we have vaccines to prevent reinfection, to prevent primary infection, to control this outbreak, I think we're probably going to see this in a seasonal fashion in winter and fall and early spring, and it's just going to ping pong between the northern and southern hemispheres.
I mean, that's a pretty dire forecast. So what do we do during that period? Do we have to social distance? Do we have to isolate ourselves? I mean, how do you think the recommendations right now from the White House are working? And what is that going to mean if we're not going to be fully okay until a vaccine comes, which could take, what, a year to a year and a half?
Well, I appreciate that it sounds like a dire projection, but I don't really see it that way if we continue on our current course. We have much better capacity now for testing. We've demonstrated unequivocally that social distancing is important. People are discussing the possibility now of wearing some sort of personal protective equipment, but some of the things that we've taken for granted in the past will no longer pertain. Some of these cultural things that we do, handshakes and kissing and so forth, may change. But I don't think that this is necessarily a bad thing. You could even say that, this, prevents us from having future pandemics, future outbreaks. One of the things that we need to learn from this is that we have to invest in our public health infrastructure, invest in our science, invest in global surveillance, so that things like this never happen again. And that's something that, we're not thinking about right now, but we should be doing so very soon, if not now.